My name is Neuro and this is my video assessment of HEENT, Neuro, Musculo, and skin, hair, nails, and head. First, I'm going to scan the room to make sure there's no cheat sheet. It's my patient Mary. Okay. Okay, I'm gonna start off with knocking on the door, then check the patient chart, provide privacy, wash my hands, and then I'm gonna ask for 2 identifiers. Hello, can you please verify your full name and your date of birth?
Mary Bordeaux, 6273.
Okay. Do you have a preference of me calling you?
Call me Mary.
Okay. So today, Mary, I'm going to do an assessment of your hair, head, eyes, ears, nose, mouth, skin, hair, musculoskeletal, and then neuro. Is that okay?
Absolutely.
Okay. Do you have any history of skin disease?
No.
Any headaches?
No.
Any problems with your vision?
No.
Are you exposed to any dangerous, hazardous materials at your work?
No.
At home?
No.
Okay. Do you have any history of shortness of breath?
No.
Any history of dizziness?
No.
Okay. Do you know where you're at?
Yes, my house.
Okay. Do you know who's the president today?
Yes, Donald Trump.
Do you know what's the date today?
February 23rd, 2018.
Okay, so what I did there is I assessed the patient's alertness. So she's alert and oriented ×4. And then I'm going to check her appearance. She seems to be relaxed. She's sitting with her hands on her lap. Her behavior is she's calm, and I'm going to ask her questions about regarding her thought process. So, Mary, do you know what's the similarity of apples and orange?
They're fruit.
Okay. Do you know the similarities of ocean and lake?
Ocean and lake, their bodies of water.
Okay. So the patient's thought process and cognitive function is normal. So then I'm going to do test her cranial nerves. So I'll begin with cranial nerves number 1. Do you have a problem smelling?
No. No.
Okay. So that means that patient's cranial nerve number 1 is intact. For cranial nerves number 2, if it's a real patient or a real situation, we're going to have to do a Snellen chart for visual acuity. For cranial nerves number 3, 4, and 6, I'm going to have to do the 6 cardinal gaze. So Mary, I would like you to follow this pen with just your eyes, okay? Can you close your eyes and open them? Okay, so the cranial nerves 3, 4, and 6 are intact. Mary is able to do the movements of her eyes without any staggering. She can do the lateral and the other movements. for cranial nerve number 5 is I'm going to have to do, for the sensory part, I'm going to let something touch Mary's face, and then tell me if you feel this stick on your face. Okay? Close your eyes.
Yes. Soft. Soft. Soft.
Okay, so for the sensory part, Mary's cranial nerve number 5 is intact, and then for the motor part, I will have to do the tempulomandibular joint. So let you open the glass. Okay. I didn't feel any popping on her TMJ. So her the motor part of her CN5 is intact. For CN7 is, I'm gonna have to let you do the puff your cheeks, raise your eyebrows, or you can unpuff your cheeks, and smile. Okay, so that she can be able to smile, puff her cheeks, and raise her eyebrows. So her CN7 is intact. For CN8, I will do a whisper test and rumbar test. So I'm gonna go behind you and then say a couple words, and then let you say it back. Okay.
One book. Two book.
Okay, so she can be able to hear what I whispered, and then I'll let you stand up and close your eyes. Okay, you can sit down. So for about 20 seconds, she can be able to stand up with her eyes closed without any abnormal movements or like swinging. So that means her CN number 8 is intact. For CN9 and 10 is, I'm gonna have to let you stick your tongue out, please. Say ah. Okay. So Mary can be able to say ah. Do you have a problem with your gag?
No.
Okay, so that means her CN9 and 10 is intact. I saw her uvula rise midline, and so yeah, CN9 and 10 are intact. For CN11 is the I'm gonna have to let you do the shoulder shrug. Okay, and oh, can you do like the distance on your face? So she can be able to do the shoulder shrug, and so that means her CN11 is intact. Then the last cranial nerves is 12. So I'll let you say light, tight, dynamite.
Light, tight, dynamite.
And can you stick your tongue out and go side to side? Okay. So Mary can be able to say the light, tight, dynamite without any problem. And so that means her CN12 is intact. So next I will do the inspect her head and her hair, and then yeah, go from there. So do you have a history of headache?
Nope.
Okay. So I'm going to palpate your head. Do you feel any tenderness?
No.
Okay. There's no lice or any dry scalp, and there's no tenderness. She mentioned that she doesn't have any tenderness in her head. So I did not see any lice or any dandruff. Do you have a history of hair falling, alopecia? Okay. So her skin is appropriate for her ethnicity. her eyebrows, hair are normal, evenly distributed. Her eyelashes are the same, normal and evenly distributed. Her, I'm going to palpate your frontal sinus and your maxillary sinus. Do you feel any tenderness?
Nope.
Over here?
Nope.
Okay, so she doesn't have any tenderness on her both sinuses. Her conjunctiva is pink, and her sclera are pearly white. And I'm gonna do the perla. So Mary's pupil are on the 4 millimeters. Her they're round and equal. And then I'm going to check if your pupils will react to light. Okay, just look straight in. So her pupils dilated directly when I directly shine the light over here, and then consensually on the other side. Same thing, vice versa. Okay, I'm gonna have to let you look at this pen, and then I'll bring it closer to you and just follow it, okay? Okay, so her eyes also did the accommodation, so without any problem. Do you have problem smelling?
No.
Okay. Do you wear glasses?
Yes, I just wear them to read.
Okay. Can you cover your nose and then smell and then sniff? Okay. Do you have problem doing that?
Mm-hmm.
Check your nose. Okay. Her septum doesn't have any deviation, and I can see the turbinate in there, and there's no discharge, and it's moist for her ears. There's no discharge as well, and it's evenly symmetrical. Do you feel any tenderness?
No.
Over here?
No.
Okay, so when I pulled her pinnas and pushed the tragus, she didn't mention any tenderness in there. There's no abnormal discharge on her ears too. And I'm going to palpate your lymph nodes, okay? And then just let me know if there's tenderness. So this is the preauricular, posterior auricular, occipital, jugulodigastric, submandibular, submental. Can you look down for me? Deep cervical chain, superficial cervical, posterior cervical, and then the supraclavicular. So when you check your, do you have any tenderness? So for checking lymph nodes, for the deep cervical chain, you have to ask the patient to look down so that the muscles over here will get relaxed. And then for the supraclavicular, you have to ask the patient to hunch forward so you can be able to palpate that. And if you can palpate the lymph nodes, it should be like small and little bubbles. And it should be palpated bilaterally with your fingers and going around. And for the thyroid, I'm not gonna palpate her thyroid, but when you check the thyroid, you're gonna have to go behind the patient and then ask the patient to look forward, down, and then to the right, and then you palpate that side, which is the right side, and then you do the other you do it the same thing to the left side, so that it relaxes the muscles where you palpate will relax. And then we're gonna do range of motion for the neck. So Mary, can you do this without lifting your shoulder? Okay, look side to side. Okay, do you feel any pain in there? Okay. So Mary can be able to do the range of motion for the neck without feeling any pain. So I'm gonna have to let you stand up. Then we'll do range of motion for your shoulder. So go around and then touch your nose, and then the other one. Do abduction. Abduction. Can you do that? Okay. Flexion, extension. For your wrist, flexion, extension. And for your knee, do flexion, extension too. For touch your hip to your shin. Okay, the other one. Okay, you can sit now. Do you feel any tenderness? Okay, so she didn't feel any tenderness or pain, so that means her muscles and joints are okay. So I'm gonna have to let you push on my, okay, and then pull, and then grab my fingers, and then, okay, and then push and pull, okay. So she can be able to grab my fingers, so her grip is tight, so that means she doesn't have any problem with gripping, and she can be able to do range of motion as well. And for assessing pain, you have to ask, for assessing pain, you have to ask the PQRST, which is the palliative, the quality, the severity, if there's radiation, and the timing of the pain. So ask, like, use the pain scale. Ask the person how did the pain start, or where does it radiate, when did the pain start, and how did the patient get the pain. So Mary, do you have any questions right now for me?
No, I didn't have anything.
Okay, so okay, so after the assessment, we're gonna document the every findings that we have, any abnormalities, and then we'll wash our hand, and then ask the patient if they need anything, lower the bed, put the bedside table close to them, and the call light button, and tell the patient if to press the call light if they need anything, and then that concludes my video. Thank you.